May is High Blood Pressure Awareness Month. Earlier today, I spoke with Dr. William Gill, a cardiologist with IU Health, and Jeff Owens, who's one of the American Heart Association's Real People, Real Change ambassadors. We started off talking about the importance of managing high blood pressure these days.
This is something that tends to be a silent disease that results in long-term effects on our blood vessels, on our heart, kidneys, and brain. And it is the single #1 risk factor for stroke in the United States. And it is one of the top 2 risk factors for heart attack and heart failure, as well as kidney failure in the United States. So it is definitely prevalent and has serious adverse consequences if we don't treat it.
Yeah, we're talking normal blood pressure, 120 over 80, right? And even if you go up just a little bit more than that, there's some serious health risks.
That's exactly right. Even just increasing over 130 over 80 may result in a doubling of the risk of heart attack and congestive heart failure and stroke. So we really do want to target those pressures down into the 120s, not getting over 130 anymore.
Is it pretty easy to manage? I know when you go to the doctor, that's usually when you get your blood pressure checked, but there are other ways to do that as well.
For sure. You know, I think that our best means of controlling blood pressure is diet and lifestyle modification. So many of us suffer from overweight and obesity, which is the major risk factor for high blood pressure. Most of us lead pretty sedentary lifestyles as well. If we can take the time to go for a walk 30 or 40 minutes most days of the week, if we can try to maintain ideal body weight, our likelihood of maintaining normal blood pressure is probably in the range of around 80% in those situations.
Yeah, and Jeff, you're kind of the ambassador for all of this as well, because you made some lifestyle changes and now you no longer have high blood pressure?
That's exactly right. I'm a retired Indianapolis firefighter, and you know, I had to make some changes, and so because I had high blood pressure, I was borderline diabetic, and I had to have a CPAP machine. So I had a lot of risk factors, and so I had to change a lot of things. I changed my diet, I changed exercise habits, because once I retired, working like I was at the fire department, I had to make some changes, and so I lost 100 pounds.
Wow! And
it made a huge difference. I'm no longer on a CPAP machine. I'm not borderline diabetic. I have no high blood pressure. So I mean, all the things that those risk factors all went away with exercise and a change in my diet.
That's incredible, really. I mean, just and an inspiration as well. Is that pretty normal, Dr. Gill, to just completely, instead of taking pills? I know a lot of folks that have high blood pressure will take pills, but to just diet and exercise and manage the problem?
It absolutely is. Now, there's no question some of us have more advanced high blood pressure than others, but I will tell you that modest weight loss, and we generally speak of modest weight loss as just being 5 or 7% of body mass, can result in marked reductions in our blood pressure such that we may not need antihypertensive therapy any longer. Regular aerobic exercise also has an impact. If we follow a low sodium diet, a diet that's certainly less than 2,300 milligrams of sodium a day, preferably less than 2,000 milligrams of sodium a day, this also contributes significantly. Increasing fruits and vegetables and nuts into our diet also seems to have an impact by raising potassium and lowering blood pressure. So lifestyle modification makes a big difference, and I make that point to most of my patients every single day.
And you can read much more about this and find some helpful information about lowering your blood pressure by going to heart.org.